name is Mariah Matas, and today we're going to be talking about cat scratch fever. Please take notes and follow along. So the first topic to go over is the causative agent, and that's going to be Bartonella henselae. You can contract this disease by getting scratched or bitten by an infected cat or through contact with an infected cat's saliva on your broken skin or on your mucous membranes. Clinical signs usually start 10 days after exposure, and they can include papules, pustules or rash, swollen/painful lymph nodes, fever, muscle, bone, or joint aches, loss of appetite or weight loss, and fatigue. To diagnose cat scratch fever, your healthcare provider will perform a physical exam, and sometimes they may take a sample of your blood to test for B. henselae bacteria, and in rare cases, they'll also take a sample of fluid from one of your lymph nodes to test for the presence of this bacteria as well. Since cat scratch fever goes away on its own in a few weeks or months, there's little to no treatment. Usually just the symptoms are treated with over-the-counter medications like ibuprofen. If you are immunocompromised, your doctor may prescribe you azithromycin for protection against the bacteria. All right, and why is all of this information important as an RVT? Well, as an RVT, you're going to be working with cats, and if a cat scratches you, bites you, or licks you in an open wound that you have, you could get exposed to B. henselae. One important thing we need to talk about is the chief complaint. How does your vet know that the cat has cat scratch fever? Well, it's really hard to tell because most of the symptoms only last for a few days, but usually swollen lymph nodes last for a few weeks or months, so if there are swollen lymph nodes, this is a telltale sign. Lastly, in relation to being an RVT and talking about cat scratch fever, we're going to discuss some of the diagnostic testing, which includes antibody testing to identify exposure to the bacteria, DNA or PCR testing to identify the bacteria in your cat's blood, and blood culture to grow any bacteria that may be in your cat's bloodstream. Thank you for watching this video, and I hope you learned something, and pause the video to take notes. Have a great day.